Well, another amazing episode with a dear colleague of ours, Dr. Gurdev Parmar. He's been a mentor to us. He's treated your family. He's another fellow Northern Indian.
Yes.
Right?
Yeah, so many connections.
Yes, so many connections.
Yeah, it was such a beautiful conversation around really our innate power that we have as human beings and how sometimes we forget. And so this discussion around arming our immune system, we talk about his book, we talk about the bigger why of why we do the things that we do and naturopathic medicine, and also his big why and the imprint that he wants to leave for the world today.
Yeah, I love how he gets excited about sharing his book too.
Mm-hmm.
You know, some people maybe I don't know, he's like a kid inside. Just he so deeply wants people to understand the power of that innate immune function. Right. And I love that. I love seeing the passion come through and how he shares. And it definitely comes out in his words in his book too. And, you know, we talked some of these core paradigm shifting experiences that we can all, tap into. And that is really appreciating this process of adaptation. The body has all the intelligence, knows exactly what to do with the moment. And sometimes we get in the way.
That's right. So enjoy. It's one of our favorite ones that we recorded.
Mm-hmm.
Yeah.
So when you're talking about immune health and how to build it, there's so many different facets to consider, right? You know, in this particular podcast, we talked about hyperthermia and really building up that the heat that generates a fever response in the body, like an internal one that actually can awaken your immune system, right?
Yeah, we also talked about the daily things that we can do as a family to support our immune system, from the foods we eat to how we move and the supplements that we take.
Yeah. So if you've got kids, sometimes they're really compliant and they'll take all their pills. But sometimes they're like, don't give me another pill. I'm so sick of the pills.
Adults too.
Adults too. I mean, I do that too, let's be honest. So it's nice to be able to have something that you can use that's actually in a quick little pack to go. It's got all the cool tools that you need, from mushroom to acacia berry to what else in there? Vitamin C, vitamin D, zinc, some of the core things, but also some antioxidants from baobab and the acerola cherry. So there's some great nuts and bolts that are in this little mix, and basically you just pour it into your water. And
the nice thing is you can carry it with you, so you can have it throughout the day. And so it's from Organifi and it's called Immunity, and it's definitely one that you should check out.
Yeah. So code is Dr. Jensen. When you go to checkout, you can get 20% off. Hello again, everybody. Welcome to another episode of Health Ignited with my amazing wife, Dr. Sonia Jensen. And we've got a special friend today on the call.
Yes, Dr. Gurdev Parmar. I met him many years ago. I think when I was in third year, I went and preceptored at his clinic, and I was in like, wow, this is what a clinic could function like. And definitely felt a connection because we have a similar background, and had my family go see him. And especially my Nanaji, who passed away many years ago. So that's my maternal grandfather, and he really took care of my family. And so he's been such a great mentor to us. And I remember when we first came back from traveling, he was the first person we connected with to get advice about our own clinic. So he's always been in our thoughts.
Yeah, he really has. And just he's such a nice guy, of course, and you're going to get to know him on this call, but he's also someone who never stops, right? I mean, when we're looking at his bio and following him from a distance, we're always like, we're not doing enough.
Yeah, he never stops. What else is he going to do?
Yeah, exactly. But I just want to share a little blurb, and then let's get into the conversation. So Dr. Gurdev Parmar is a co-founder and medical director of the largest naturopathic health care facility in Canada. The Integrative Health Clinic is in Fort Langley, for those of you that are in the Vancouver area, but he's also licensed in Washington State. And he was chosen one of 7 original clinics to participate in the Canadian and US Integrative Oncology study, which is an ongoing multi-clinic prospective trial. And Dr. Parmar has also completed an 8-year retrospective study on his treatment approach. And so I'm just going to step away from that because there's so much to share here. But basically, this is a gentleman who's taken what we've learned in naturopathic school and taken it to just so many deeper and more, impactful levels. He's written the book, a textbook of naturopathic oncology. I've got the book here called Arming the Immune System, with some notes and stuff that we're going to talk about today. But Gurdev, it's like you just never stop. You're so deeply invested in the care of the human frame, the body, the family medicine, taking care of people who are really sick. And just, we really want to, we were so excited to have you on the call, and it was hard to find the right time, but we eventually got you, and we are in the middle of sort of the immune season of the year. And so we're just so grateful that you're here with us today.
Thank you both so much. What an amazing intro. That might be the best intro I've ever had in my life. That was so special. Thank you so much. You guys are lovely.
Thank you. You know, like I said, it's been a long time coming. We first reached out to you, actually, when you launched your book. That was back in, was it March?
I think so. It was last year around March. Yeah.
Yeah. And so I got through the book, and it's amazing. There's so many insights in here, which we're going to jump into. But there's something that's really beautiful about doctors who really anchor into the roots of the medicine, and also have their feelers and deep knowledge of progressive medicine and what's to come. So you shared a really beautiful story of why this book was so important to you now, and is really about tapping into some of the stuff that you learned even in undergrad. But I'd love for you to sort of take us on this journey of why understanding the relationship to the body, our ancestral knowing of what the immune system is all about, and how that merges in your current practice.
Thank you again. So yeah, I did my undergrad at Simon Fraser University, which we were just talking about before we got on this call, where my second son is now going, which is incredibly special. But yeah, my undergrad was in biological sciences, but I really focused on evolutionary biology. You know, it's a big question, you know, where do we come from? Why are we all here? Is there a God? Evolutionary biology is something that I really dove into because it helped me understand where we are on planet Earth and how we got here, and from a biological perspective. And I don't think that's at all separate from a spiritual belief. You can have both. I think you can have both belief systems, which I do. But yeah, evolutionary biology was a great undergraduate degree. And during my undergrad, in my last year, I did an 800 level course, like a master's course, called Darwinian medicine. I always had a plan of going into medicine. And this was a really interesting course where what happens to us as human beings was described and explained from an evolutionary perspective. Like, why do we vomit? Why do we get diarrhea? You know, why, when we hurt our ankles, does our ankles swell up like this? And why do we build a fever? These sorts of whys, you know, these questions to me are the most interesting. Why does our body do what it does? And that course really helped transform my understanding of not only the human body, but what sort of medicine I was drawn to. It actually brought me to naturopathic medicine. I had never heard of it growing up in a small town in BC called Kitimat, where there were no naturopathic physicians. I didn't even know what an ND was. And I learned about it at around that time. So yeah, evolutionary biology and why the whys, why does the body do what it does? And then how do we as physicians, as naturopathic physicians, how do we treat a human who's displaying some of these symptoms? Is it always best to just take those things away, or is it sometimes better to just step back and let what's happening happen because it's in the best interest of the body, right? Mm-hmm. Yeah, and specifically, as you know, that book is about fever. And I personally think that the fever response is just awesome. Something literally to behold. It's phenomenal if you understand it.
Mm-hmm. Mm-hmm. Yeah, one of our other colleagues, Dr. Kathy Carlson, once said to me, because I often went to study with her, that every time she saw a young child go through a fever, there'll be a developmental leap. And that gets missed so often because we're not trained to understand what a fever actually is and what it's doing in the body. But instead, we've been indoctrinated with this fear around what could happen. So maybe if you could break that down for us a little bit of like what is happening in the body when there's a fever.
I'd love to. So it essentially uses every system in the body. So the skin is involved, the cardiovascular system is involved, the neurological system is involved, of course, the immune system is involved. So essentially, this is what happens. So let's back up a little bit and understand some really fundamental facts that will help describe what fever does. So just think, I mean, I don't know about you guys, but I think it's pretty interesting that the average temperature on Earth is 16 degrees Celsius. The average temperature of a human body is 36 to 36.5 degrees Celsius. Whether you live around the equator or whether you live in the North Pole, our body temperatures are held at about 36 to 36.5. Why? I mean, there must be really good reasons why. And why, when you look across the entire animal kingdom, every mammal, every fish, every bird, every cold-blooded amphibian, certain insects, everything will raise its temperature 2 to 4 degrees Celsius on average if it's sick, if it has an infection, a bacterial, viral, fungal, parasitic infection, or even early on in cancer, when the body's trying to mount a response. That's a very interesting thing. There's four body temperature scenarios that we can all experience through our lives. Normothermia, meaning we're at around 36, 36 and a half. Hypothermia, where your body wants to be at 36 to 36 and a half, but because you fell into an ice bath, it's colder. Or hyperthermia, where you're on a beach, you haven't had much to drink, or maybe you've had too much to drink, which wasn't water, and you're out in the sun, and you can get hyperthermia, where your body still wants to be at 36, 36 and a half, but it's much hotter. And then there's actually fever, where the set point, the thermal regulator in the hypothalamus, the set point has increased. The body now wants to be at 38.5 to 40.5 Celsius. And your body goes through a process to get you there. And that process is just awesome. So we release all these what are called interleukins or chemicals in our body, like interleukin 1, interleukin 2, interleukin 6, tumor necrosis factor. All of these things are released through the entire system. Our skin does things, like the pores will at first close down to retain the heat. And that's when we get all dry. And the heart will beat faster, and the blood vessels in the periphery will shut down, and the ones in the center will open up. And all of these things are happening. All of those interleukins and tumor necrosis factor go up to the brain and then to the hypothalamus, specifically the preoptic area of the hypothalamus. And that's where PGE2 is released, prostaglandin E2, which is really what raises the thermostat, the set point, which is what Tylenol and NSAIDs, non-steroidal anti-inflammatory drugs, are meant to block. PGE2, which is what lowers the temperature and takes away all these horrible feelings of a fever. I've got chills and I have aches and I don't want to eat and I want to be quiet, and your body's doing all that for very good reasons, but everybody wants to run around while they're sick to continue to live their mad lives, and they want to suppress that fever just as quickly as possible so they can keep doing the thing that they want to do, which I believe is ultimately to our detriment, because we're not letting this incredibly intelligent 400 million year old process run its software, which is like exercise for the immune system, which is why the incredible CCR, Kathy Carlson-Rink, says there's a leap that happens in a body every time we build a fever. And I believe that's absolutely true. I think we're running a program which is ancient and smart, and it's exercising a system that needs exercise just like everything else does. Like, you guys look fit as fiddles. You exercise all the time, right? So do I.
We just went for a run this morning, so yeah.
Of course you did.
Every day.
Of course you did. Then you had an amazing shake. I've been watching you guys a little bit. Yeah, so that's ultimately it. I mean, I know that over the next while here, we're going to keep digging into this, but that's kind of the big picture.
I know you want to say something,
Go
but
ahead.
before you do, I just want to highlight something really important that you said about the state of our like conditioning and culture around being sick, and how we're so programmed to just keep going and keep doing because there's so much fear around loss of whether it's significant or financial or whatever that may be, but that drives our decisions. And so we are really asking people to like reflect on why they're making the choices they are when they're going to suppress a symptom. There's usually something deeper going on, not just I got to get out the door. It's more like if I don't get out the door, what will happen?
Right.
But if we are to like sit back and reflect on all of that, we can then understand how much power we do have in this body and not rely on the outside world so much that dictates everything. So I just think that was really important to highlight because I think that's the big why of why we do anything and make the choices we do.
Yeah.
Absolutely.
And I feel like there's, man, like this past 2 years have really showed the inherent paradigm shift that we collectively need to move into. And I think, you know, to the point of like, there's a preference. I'd much rather not be sick. Like being sick sucks. But I think we're also just afraid of or feeling out of control, like not really being in relationship with what's actually happening. Like you're speaking to everything from an adaptation point of view. Our body has adapted, you know, millions of years and it knows exactly what to do, but we're at conflict with the discomfort. I seriously think that we just don't like feeling pain. And so we're trying to avoid as much as we can. I hate having a runny nose too, or like postnasal drip or like watery eyes or sneezing. Like no one likes that. And I think that we've related to that so much as that being bad because it's so like you feel gross. You feel sometimes you're achy. It's like we want to avoid pain wherever possible. And this is part of this. Like your book is so good at just bringing back this information of like, this is exactly what's supposed to happen. And, you know, it's like, why can't we just have a conversation about this? So, you know, when you talk about these cytokines and these interleukins and all these things that are going on, there's definitely people that seem to not be responding to them in the way that maybe they used to. And you definitely see this with your cancer patients, right? Could you talk about, like, is there a cytokine burnout? Is there like a communication breakdown in the hypothalamus? Like what's happening when people aren't getting the messages?
That's a good question.
Yeah.
I actually don't know the answer to that. I have hypotheses, but I don't really know the answer. One of my hypotheses is, as you've read in the book, there's actually something called an afebrile diathesis that's been documented since the mid-1800s, where doctors have noticed that people diagnosed with cancer have had a striking lack of fevers through their lives. Mm-hmm. And, you know, I unofficially tally all of my patients, or as often as I can remember, which is a lot, because I'm so interested in this. I think somebody's going to win the Nobel Prize. It won't be an ND, I'm sure. It won't be me. That's for bloody sure. But somebody's
you never know.
Yeah, right. Sure. But there's a striking lack of fevers through the lives of people that end up having, you know, a lot of chronic diseases, including cancer. And maybe it's because as children, every time their body tried to run the software, it was suppressed. Mm-hmm. Maybe. You know, most of my patients say to me when I ask them, you know, can you remember the last time you had a really significant fever, or have you had many fevers through your life? And most people are like, you know, I'm shocked I got cancer because I never get sick. Like everybody around me like drops and they're like, you know, they have all these terrible symptoms and I just fly through it. It's like nothing's even happened. I'm fairly certain that they're being exposed to all the same viruses that cause illness and everybody, but their immune system is it's our body that actually creates the symptoms of infection. I mean, infection.
Yeah, talk about that a little bit, because I don't think people really understand that. They think the virus, the bacteria is causing the symptoms, right?
Right. Well, in a way they are, because if you think about it, let's say a bug gets into us, and our first line of defense, the macrophages and natural killer cells and those Pac-Man looking cells, they'll engulf whatever it is. And when they do that, they're the ones that are releasing the interleukin 1s and 2s. Interleukin means communication between leukines or white blood cells. So this is the method used by cells to communicate with other cells. So if a cell in your hand wants to communicate to a cell in the brain, they send interleukins. So IL-1, IL-2, IL-6, tumor necrosis factor, all of those things get released. And when that message is sent, that's what interleukin-1, for example, we know it was the first interleukin discovered, and we know it makes you get aches. It makes you get chills. It does that for good reasons. The body's trying to tell you, lie down. Like, don't run around. If you're so achy, lie down. I don't want you to feel good. I want you lying down. I want you being quiet. I don't want you eating, because building a fever is very expensive calorically. It can take up to 50% more calories in a fever state than at a normothermia state. Well, that's a lot. I mean, just think of that evolutionarily. You know, when we couldn't eat Chiquita bananas 365 days a year and whatever we wanted, whenever we want. Now we call it intermittent fasting. It just used to be called life, right?
Yeah, totally.
Or 3-day fast. Like, we do those things now, but we've always done that throughout history. We're meant for it. It's good for us. But yeah, the reason why we lose our appetites for good reasons, the reason why we get aches, the reason why we get chills, all of these things happen for good reasons. The immune system, the body, is trying to elicit a response for you to conserve energy to fight the fight. And by suppressing that and continuing to use your calories unabated, and you have this infection sitting in you, and you're not actually able to mount a response, all the research shows that's been done on this subject, which is incredibly not that much over the past 100 years, your infection's going to last longer, your symptoms are going to last longer, you're going to be sick for longer because it takes longer to get rid of whatever you have, because you haven't let the immune system run its software.
Is there ever a time, now from a parent perspective, and I know you have children too, so maybe these are conversations that you guys had, when, like, if you're talking to other parents, when is it a time to use something to suppress a fever? Because what they're told, or what we're told, is that they could have a seizure if they reach a certain point for these many days. So when is it applicable, or is it even applicable? Like, maybe just to give some clearance around that.
Great questions. So there's 3 populations of people where managing a fever really might be important. So a very young child, an infant, whose thermoregulatory system, their hypothalamus, their preoptic area of the hypothalamus, whatever, or their whole system is not yet fully developed and able to manage what could be a potentially serious infection. So infant children, not yet developed enough to manage. People that have had traumatic brain injuries, where that part of their brain has been injured or damaged, and they're unable to do that thermal set point thing. And what is the ceiling? And is it able to run the software properly anymore because the hardware has been damaged? So them. And then I would say, like, extremely cachectic patients who don't have the reserves in their body any longer to manage the 50% caloric increase of a fever. Those 3 populations of people, I think managing fever is important, and the research bears that out.
And there may be
anybody else, maybe not.
Yeah.
And there may be some, with each of those situations, it's not like you're getting on management right away. Like, is there an observation period where you're like, okay, it's been 3, 4, 5 days? Like, is there a number of days basically where you start to go, okay, now it's time to manage?
Well, I can tell you, like, in hospitals, for example, where the extremely cachectic, wasting patients might be, or these traumatic brain injured patients are, their fevers, as a rule, managed immediately. No waiting process. It's just like prophylaxis. Like, we know what could happen here. It's going to be managed. That used to be the case for many things. I mean, it's been shown that, for sepsis, even bacterial infections of the blood, many severe infections where it was always thought that the best thing to do was to manage the fever. Well, when you compare the population of people that had their fever managed and didn't, there's really no difference in days in the hospital or that. In fact, if there is a difference, like I mentioned earlier, the infection might actually be worse and the symptoms might actually last longer if you suppress the fever.
Yeah.
But Sonia, to your question, it's a very important one. I mean, yeah, I have 4 kids. My wife and I have been through this process 4 times. Young infant children, or toddlers. At what age do you become comfortable with them being able to manage a fever? It remains a good question. I think this is one of the toughest questions there is when I talk about this, because there's no ideal cutoff. It really becomes a relationship between the parent and the child, and the trust.
Yeah, and the tools, I think, too.
And having the tools that you think you need, right?
Yeah.
Resources. It's not an easy question to answer. I don't think there's a perfect answer for it, actually. I think it's parent by parent, child by child, family to family. Everybody has to come to that decision. But I can say this, even in children that have had febrile seizures, the evidence shows that if you manage them with NSAIDs, it does not at all reduce their risk of having more febrile seizures. If it's a child that gets febrile seizures, they get febrile seizures. And if it's a child that doesn't, they typically don't. 2 of my boys pitched like the best fevers ever, like delirious fevers. Like, I'm sure they don't want me talking about it, so I won't say too much, but sometimes it was thought that there might have been things in the rooms that weren't there.
Yeah.
It's part of the medicine.
Yeah.
Right. Exactly. Yeah. And I'd be like, yeah, great fever, kid.
Yeah. Yeah, it's funny when I'll say to my kids too, when they have a fever, that I love it. One, they're like extra cuddly, because I feel like when they have a cold, they're annoying. But when they have a fever, they're like super cuddly. And also just, it's such a teaching moment for kids too. Like, look at what your body is doing. So now all you have to do is let it rest and do what it needs to do. So I think it's such a teaching moment. The thing that I still need to work on, and this is probably my Indian background, and I know all this, that I shouldn't feed my kids when they're sick. And I normally don't.
Yeah.
But there's like,
or we just listen to them, like,
there's just this feeling of like, oh God, I'm not feeding them. Where are they going to get their nourishment from? Eat. But they don't need to.
Yeah. What's the saying? I think it's a feed a cold, starve a flu.
Right.
Yeah.
Right.
What in the book, you did a brilliant job of describing the difference between hyperthermia and a fever. Could you break that down? Because there's some really great ways or tools that maybe people can implement at home, just learning this. Yeah.
So hyperthermia, you guys recall that I mentioned the 4 states of body temperature. Normothermia, where we want 36 and a half. Hypo, you got too cold, but your body didn't want you to. Hyper, you got too hot, and your body didn't want you to. The alcohol on the beach scenario, which a lot of people have experienced. So hyperthermia is not your body's intention. It's just trying its best to manage the fact that you overheated when the thermostat didn't want you to. Your thermostat was still set at 36 to 36.5, but you got too hot. And hyperthermia is where it can run out of control because your body wasn't trying to control that. And you can pass out. I mean, you've heard of people dying from extreme hyperthermia.
It happened here in the Lower Mainland. Even was not this summer, but the one previous, right? Yeah. Lots of people died. Yeah, during
the heat.
Yeah.
There's another thing, right? The world outside of our bodies is also experiencing some extremes of temperature these days that are so interesting around the world. Apparently, we have nothing to do with that.
Right.
It's just happening. So hyperthermia, your body doesn't really want to be there. It can run out of control. You can pass out. You throw up. You just feel terrible. Fever, very well designed system where the thermostat's been raised to 38.5 to 40.5, and your body does everything to get there. And once it gets there, that's when, like, just think of it. You've had fevers through your life. At first, you just want to bundle up. You feel super hot, but you're cold. That experience, right? Because as I said, all the blood vessels on the periphery have closed to keep the blood inside to raise the temperature. And that's what happens. And then once you reach the temperature that your body wants to be at, that's when the sweats start.
Right.
Because now your body's letting off all that heat. It's just so smart, isn't it? So yeah, if hyperthermia and fever are very different processes. Hyperthermia should be managed. Like, you need to get hydrated and you need to get your temperature down, and you probably want to be put into a cool bath or a cool shower. You want to get some fluids in there. You want to bring your temperature down now.
Yeah.
Fever, of course, as you guys know, I'm recommending you don't bring it down. You let it do its thing. You bundle up. You cook it out. You get that fever going. You sip on fluids to maintain your hydration, but you're not doing it to bring down your temperature. Incredibly different experience.
Yeah, definitely. It's an important one though. What about saunas?
I was going to ask that.
Yeah.
Too.
What do you recommend your patients do with saunas? There's some incredible studies and the Finnish studies on all cause mortality reduction with hyperthermia states. I
recommend my patients use sauna. I use hyperthermia in my practice. I use treatments to raise my patients' body temperatures, try to build fevers. And sauna is a wonderful way to do low-level hyperthermia. So you're not raising your core body temperature too much, but you're experiencing so many of the benefits of increasing cardiovascular output, and you're exercising the largest organ of your skin or your body, which is your skin. You're detoxifying, you're doing all of these, you're doing things for your brain, you're increasing the production of all sorts of wonderful chemicals, you're doing all of that. And yeah, the research out of Scandinavia and Europe, you look across every culture on the planet, sweat lodges here on our continent, fever therapy or heat hyperthermia has been used forever by human beings. It's just a very intelligent thing to do. And now I think we're learning also, like, so is really cold.
Yeah, definitely. Do you have one of those yet?
I have a place for it. But I don't have one yet. So my wife sometimes makes fun of me, Karen, my partner in life, just like you two lovely people. I'm married to my partner in life, my best friend, and she's an ND as well. I research the crap out of everything. Okay, so I've been looking at cold plunge tubs for a year. Like, it's absurd. I don't know which one to get. Do I get the barrel? Do I get those really nice ceramic ones? Do we need to talk? Do you guys have an answer for me?
I was just going to go simple. We're just going to get the barrel.
Yeah, the barrel looks great.
Yeah. It doesn't take up a lot of space. I mean, there are some much nicer ones.
Yeah, I've seen some.
Right?
Yeah, but the barrel looks great.
Yeah, totally. You just put it in the corner.
Yeah,
you're only there to get cold. You don't have to. You're not going to lounge in there for that long.
And sauna to that.
Exactly.
Yes.
Yeah, I love it.
Yeah.
I know you did bring up some discussions on NSAIDs. Is there more? I mean, it plays a suppressive role. Is there anything else that you think that people need to know about NSAIDs?
Oh, we
talked about
amazing.
So much, but yeah. Okay.
like honestly, you think about it.
They're powerful tools, right?
Wow, they're incredible. I mean, from ASA, I won't mention brands, but like from acetylsalicylic acid, salicylic acid, as you guys know, is a very old naturopathic remedy. It's been used for thousands of years. Comes from the bark of a willow tree. I mean, it's effective. I mean, if you could take it in high enough dosages without ruining your stomach, that's why ASA exists, right? They changed it. They put an acetyl group on it. Now it's not as bad tasting or hard on the stomach. And then, acetaminophen and ibuprofen, and all of these drugs like diclofenac, they are so powerful. You reduce the production of PGE2, and it has a profound impact on so many different things like makes you want to eat again. You don't have any pain anymore. You don't feel so bad. Your headache's gone. Whatever it is, whatever your symptoms of feverish stuff is, it works. They also work, as you guys know, and they're used every day in most houses of the world for every ache and pain a person gets. Yeah. So
I think that's an important distinction, is the overuse of something, whether it's those or antibiotics or anything. When it's the overuse, we lose its essence and we lose its ability to actually do its job well when the body actually needs it.
Correct.
I think the more people understand that, and this like knowing of the immune system and how it works and what we can actually do on our day-to-day to help support us. So do you have like a morning ritual or things that you do every single day to arm your immune system or to help support your body and your families that other people can tap into as well?
You know, I don't really have a specific morning ritual that I can say. Literally every morning of the week is different. It's very regimented, but like for today's example being a Monday, my morning ritual is very different than it is on Tuesday, Wednesday, Thursday, when my clinic days are just, it's all about that. So I wake up at 6 a.m. I go through all of my patients' files in the morning, first thing after I do the things that I need to do to get ready and then get the kids ready and whatever. But I think the answer to what do we do as a family to work on our immune systems, it's literally the lowest lying fruit. It's eating really well. We eat a very, very clean diet in our family, dramatically reduce the intake of things like refined sugars and refined flours and refined food, period. You know, like I tell all my patients, if you can buy it in a corner store, don't buy it. Or, you know, you guys know. So lots of fresh stuff, as natural as possible, as close to the evolutionary traditional diets that we've had. I'm very evolutionary in my thinking, period. So if that also applies to diet. I know there's so many diets. I have patients every day asking me about what about this diet, what about this diet, and I find myself talking about eat as closely as possible to your genetics as well, you know, as you can, and not like of today, because what does that mean? I mean, like of the past.
So how do you do that in your household? Sorry to cut you off.
It's interesting.
We have two different genetics over here too.
Yeah, it's interesting. Yeah. But you know what, my dear, you and I are both North Indians, and I would say that the Northern Indian diet has more similarities to a European diet than dissimilarities. I mean, let's be honest, all Caucasians come from our neck of the woods, and we traveled west and then occupied Europe. So, you know, we are the birth of
the original race.
and people misuse the word Caucasian. We are Caucasians, actually. So there's Caucasoids, Mongoloids, Negroids, and Dravidians, and look at us. Other than skin tone, facial structures, everything else very similar, right? So yeah.
Thanks for breaking that down, because that's a common fight in our household.
Yeah, no, I think more similarities than dissimilarities. Other than the fact that us Indians, you know, the holy cow thing, we're way better with dairy than a lot of other populations on Earth. But yeah, you know, I think we're omnivorous. You know, eat animal products and vegetables and nuts and seeds and beans, lentils, and most other things are very similar. Whole grains, ancient grains, whatever. Like it's similar, I think, enough. So we do a fairly good job. I mean, it's basically fruits, vegetables, nuts, seeds, beans, lentils, whole grains, and fish, and clean birdies and their eggs. The periodic clean four-legged animal. You know, that's the family diet. Mondays and Fridays, dinner's on dad. So, you know, I also throw in a lot of mushrooms in our diet. So, and then lots of exercise. I mean, so diet has to be spot on. Physical activity might be the most important thing, in my opinion, for everything. So, like my boys play a lot of hockey, and they play a lot of tennis and a lot of golf and a lot of basketball, and we're constantly doing everything. And our house is like Wonderland. You know, we got a sport court in the backyard where we can play a ton of sports, and we have a putting green in the front. Like,
Nice.
we're always doing physical activity. We're riding bikes. Like I told you guys, we do a lot of outdoor stuff, like hiking and stuff. My older two boys and I just finished doing the Juan Fica Trail, as I told you. So yeah, physical activity. We get our sleep. You know, Karen's very militant about sleep time, so sleep at the right time, get lots of rest, wake up in the morning, get the day started with some good food. I think a lot of stress reduction techniques. My boys do mindfulness practices before hockey games, and are doing visualizations and stuff at a very young age, with tools I wish I had when I was younger. You know, you guys know all this. We supplement with the things that we know we must supplement with. We're not like, okay, the supplement cupboard's really full, but you know, only taking certain things at a time, right?
Yeah,
So all the right things, you know, we do all the things that we know we should, and then we do a lot of things that we shouldn't, and keep it honest, right? So we live a good life, you know, a good balance. Karen and I both believe that you have to work hard and play hard, and that's kind of the life that we live.
And when you bring up exercise too, you labeled that as one of the most important things. I mean, it's another example of hyperthermia, right? It's another way that we build that heat in the body, and
exactly.
You know, if we all just listen to what you just shared there over the last 2 years, you know, if that was the public health message, you know, it's inside out, it's outside in, it's everything. You know, if that really was, if we really wanted people to get healthy, we would have been sharing that message far and wide. And that would have been such a huge saving grace for the millions of people and the millions of families out there, because it's so easy. We started this conversation with that paradigm of being in fear, disliking the feeling of being sick, afraid, like nobody's business, that we might feel some version of discomfort, and then our mind takes over and everything else, and our dietary habits go out the window. And I mean, this is a core teaching within your clinic. So, you know, how do you reconcile that when you're hearing that outside, when your patients are coming in fearful? I mean, our message doesn't change really, but how did that sit for you? And I mean, that's part of why you wrote the book, but if you could share a little bit on that, that'd be amazing.
So I found the messaging through the past 2.5 years very difficult, actually, on a personal level. I felt that the information that was being shared with the public was very one-sided, not at all educational, very fear-based. I felt actually deeply sad for the people that I could see around me in my community that I know were living in abject fear every single day for the last 2.5 years. The amount of anxiety and stress that I saw people living with day to day was just, it's just very difficult it was difficult. I can tell you guys, I mean, I had to write this book to get out a lot of energy that I was having a difficult time managing. You know, as you guys know, we have 2 clinics. Lots of people work for us. Lots of people, their livelihoods depend on our clinics. And we, of course, followed every thing that we had to follow in British Columbia from the PHO, from the Public Health Office. And we continue to. We still have signs up everywhere that, you know, you need to wear a mask, and all of our staff are doing that. And I know all the data on all the masks. I know all the data on which masks actually work and what the most of the masks that are being used do or don't accomplish. I have been keeping abreast of all the vaccination data. I've been keeping abreast of what people are actually getting very ill from this virus. I know what an RNA virus is. I know what animal reservoirs mean. I know what being a respiratory illness means. And when you know all of those things and you see what the response is, and there's a massive disconnect, it's hard to manage as a human being and to keep zipped up about it, which, you know, I sadly, you know, I don't know how I'm going to manage this even long term, because I know I had to bite my tongue over and over and over again for so long. And I'm going to look back on this and have some regrets. I know I will. I try not to do that. I don't really live in the past. I don't really live in the future. I know this is all we have. And right now it's just great. I'm so happy to be with you too. And, you know, it's been hard to reconcile, quite honestly.
For sure.
Mm-hmm.
And you're not alone. I mean, that's been most of us. And I think knowing what we know, and then seeing patients get better. I mean, that's a big thing too. It's not like this is our first rodeo, you know? And so, and when you're working with people such as you are, and, you know, with these cancer diagnoses, they're already living, maybe not all of them, but probably most of them are already living in fear.
Mm-hmm.
And so to see this extra weight being put on them and this re-education, you know, I could see this book really just being a way out of that. You know, that knowledge can be powerful for people when they really step into what they can do to take care of themselves. So, you know, hats off to you. I think this is your reconciliation.
Mm-hmm.
Truly is
a big part of it. And, you
Absolutely.
know, what I did with myself, with my patients in my office every single day, and the conversations that I was able to have with each and every one of my patients on a one-on-one basis in my office in a safe space, also was a part of the reconciliation.
Definitely.
For sure.
It's like creating space for that remembrance of that power that we talked about in the beginning.
Yeah.
Of that internal power, of the fever, but taking that same concept to everything. And it goes back to that why that we were talking about in the beginning, like why do people choose to suppress things, and why do people choose certain things? It's because of those bigger elements, those bigger elephants that they're dealing with every single day.
Yeah.
And so we can't necessarily control how people will react to their outside world, but if we keep educating and really teaching them that there is power in their own being, I think, or I hope, my hope is that those seeds will definitely flourish at some point.
I believe that. I tell every one of my patients on the first day, the docere, you know, like in our oath, like I love our profession. I'm so proud of what we're able to do and the knowledge that we have and that we share it with humans. We're so blessed, right?
Mm-hmm. Truly.
But I tell every patient on the first visit, every time, what docere means. And really my job is to educate you, and whatever decisions you make, I support your decisions. Like I just want to do my best to inform you so you can make informed decisions. And this is your life, this is your show, this is your body. Like you get to make your own decisions. My only hope is that you're making informed ones. And, you know, in order to do that, you need to know all of your options. And I mean, nobody knows every option out there. Thank goodness. But in my own personal purview, in my own toolbox, these are the options that I am aware of, like conventionally and naturopathically. And here are some options that are not conventional or naturopathic that you might think of outside of those two worlds. And, you know, I think choice. that's about choice. And how powerful is that? I think it's ultimately what we all want, right?
Yeah.
I love it. So before Sonia asks her final question, where can people get Arming Your Immune System? Please tell us. I know you can get it on the website, but yeah, maybe you could share that as well.
Yeah, so I have a website, which is just my name, drgurdevparmar.com. So it's available there. It's available on Amazon and Kindle. I have to say that. Yeah, that's where it's available. It's available in our clinics, and that's it. Those are the places where it's available. Yeah, And what was the other question? I think you asked me two things. Where can
I have
people
a
get
final
it?
question.
Sonia has a final
Oh,
question.
Sonia has another
Yeah.
question.
Yeah, so this is usually the final question we ask all our guests.
All right.
It's kind of a bigger picture question
Okay.
of if you knew tomorrow was your last day in this physical form on this earth, what is the imprint you want to leave behind?
Oh, man. Well, that's a big question.
It is. You can take your time.
Okay, I think I'll need to. Well, first of all, I think the most important imprint I want to leave behind is on my 4 boys.
It's the most important one.
Wow, what a question. That's the biggest imprint I want to leave behind. Is my, I just want my boys to remember their dad as somebody that loves them endlessly and just is so proud of them.
I love that. Your heart shines through, you know, in hearing you speak, lecture, in your writing, you know, even sharing this, you know, heartfelt message. I hope your boys get to watch this video, because seeing that love from a father, which, you know, historically wasn't really shared in the way that it is, you know, in these days now, and the fact that you wanted to show up that way for your kids is huge, because that's, I mean, that's the kind of heart you bring in when you work with your patients as well. So beautiful message.
Yeah, thanks. And then, yeah, you know, professionally, the imprint I want to leave behind is that naturopathic medicine is the future of healthcare, with knowledge being more available and people having the ability to learn that their options for their bodies and their health is far beyond what they might learn from one particular perspective, is really important. And I really want to see our profession continue to grow as it has been for the last however many years, now decades. So yeah, that's professionally, and I really, you know, I know in our profession this might not be shared by everybody. I know that in the world of naturopathic medicine, might sit on one end of the spectrum. But I really hope that we as a profession can come together, unite in what our strategy is going to be to move forward. And what does it mean to put our best foot forward as a profession? What really can we do to serve humanity and the public? I think we have an incredible scope of practice. We have doctors that have come into this profession from so many different backgrounds. They had so many different intentions of what they wanted to do with the medicine. They had their own dreams and aspirations of what being an ND meant to them. And that's broad. I mean, you guys know, we have some patients or colleagues that will do just mind-body talk therapy. We have some doctors that do all hydrotherapy, some that do all homeopathy, some that do just botanical medicine and herbology, some that just manage nutrition and diets, some that just do musculoskeletal stuff and only use needles and injectables, some that just do cosmetics and aesthetics. Like, the scope of our practice, the scope of our medicine is broad. And I'm very passionate about this. I really think that we as a profession need to think about what it is that we want to do as a profession for the future of our medicine. And I think we're at a critical time. And I just want to be one of the voices there. because I think I have a specific sort of perspective. And I know lots of people share it because I have lots of preceptors that come with me. I have my 4th resident starting with me tomorrow, Sarah Donater from NUNM in Portland. And I lecture a lot for our profession, and I go to lots of conferences, and I know there's lots of people that share similar visions for our profession. And yeah, so I think that's one of the things that I want to leave as an imprint, as well as on our profession. What does the future of our medicine look like?
We want you to be that voice.
Mm-hmm. Yeah. Absolutely. Dr. Parmar, you're a beautiful man inside and out, and I love your message, love all you shared. I want people to check out your book, Arming the Immune System, and thank you for taking time with us today.
Thanks, guys. I give you both my love.
Thank you.
Okay.
Now you're off to a tennis match. You're going to go induce hyperthermia. So...
I'm going to go spank some balls around real hard.
I love it.
All right, guys, have a good one.
Lots of love.
And thanks. You know what? Anytime you want to do this again, I'd be honored.
Definitely. Yeah.
Keep up your good work.
Thank you.
You guys are amazing colleagues.
Thank you. We'll definitely do this again.
Okay, bye for now.